Aspires Nutrition event. We are kicking off 2023 with nutrition, as we traditionally do. And I am so privileged to be here to host this session. My name is Mo Hagan, Chief Operating Officer at CanFit Pro. And this is session 1003, a holistic and nutritional approach to thyroid health. So we're going to jump right in today. We have a lot to cover, and it's so great to have so many people here. I have a few housekeeping details, and then we're going to jump right in with an introduction. And let me tell you, this session is packed with education, latest and the greatest, and it is a full 90-minute session. And we are excited for you to interact with us. So first thing to know is you have a chat box. Your mics have been automatically muted, but please use the chat. You can pull that up on a second screen or however you like. And please, in that chat box, you can interact with each other. You can certainly share your comments with our presenter today. You can ask questions. We will take time to address those for you. And you can also use a feature in Zoom, which is called closed captioning.
Yeah, Monday's the 6th.
Oops. And
then Sheila hasn't scheduled a time yet, right?
No, she hasn't.
Okay.
Danielle?
So next week is PDAC.
Can we, Mary, put Danielle? Thank you. We're doing a little in the background, multitasking, I guess, from the team. But thank you, Mary, for doing that. We have Mary working as moderator today, and she will also support me in following your questions and dropping things into the chat box that support our presenter today. So I want to jump right in with our very distinguished presenter, who I've had the opportunity to meet as we discuss this session to prepare for today. And I am absolutely impressed with very, very unique background in our subject matter today. Dr. Zarrin, she holds a PhD in integrative medicine, a diploma in classical homeopathic medicine and science. She has a degree in nutritional sciences as well, an honored diploma in medical aesthetic and anti-aging, certificates of achievement in homeopathy, certified in a number of unique therapies, has a clientele or patient roster that is from around the globe. She is the author of Quantum Anti-Aging, the founder of Integrative Medicine and Nutrition, founder of Homeopathy and Nutrition Clinic, the founder of BioQuantum Academy Canada, and I'm going to keep going, the chairperson of the scientific advisor and speaker at Global Scientific Guild Conference, and as well as that, the founder and leader of the Canadian National Health Campaign, and lastly, founder of International Integrative Medicine Diploma and Research Platform. So you are in for a treat this afternoon. I am so happy to meet you, and I know you will be highly impressed by Dr. Zarrin. So we welcome her and thank you. Great to have you here today.
Thank you so much for your wonderful introductions. Amazing. It was so much passion in your words and your voice. Appreciated. Yes, whatever you said, that's right. But it's a result and lifetime investment from 3 decades ago. So at this point, I just want to let you know that first of all, I would like to extend my appreciation to CanFit Pro and Aspires Nutrition for inviting me, especially Mo and Mary. I'm delighted to be here and present and share my perspective, my view, and my gathered knowledge with you all. As Mo mentioned, introduced me, yes, I'm a homeopath and nutritionist. But I'm not coming from mainstream medicine. And at this point, sometimes I have to share my frustrations that is happening around the globe and through my challenging practice in North America. But I just want to let you know that I am not criticizing anyone, because I know all the medical practitioners on their oath, they're trying to help. But I would definitely criticize people that they harm. So at this point, I'm coming from different backgrounds. I would like to appreciate as I said, CanFit Pro and Aspires. And this is an amazing combination. Congratulations to both of you. I have a wonderful quote. I would love to always share it, that correct fitness and exercise regimen would work like a king, and right food and nutrition works like a queen. And when combine these two together, you can create a healthy kingdom. So definitely without a correct kind and level of activities, a right and sufficient amount of nourishment, there is no restoration of health. And always activations of inner healing power need these two essential health elements. So CanFit Pro and Aspires Nutrition, and I think most of you know that I already had videos and I already advocate for your events. It's amazing. I would like to start my presentations with the very famous quote from Hippocrates: "Let food be your medicine and medicine be your food." I think everybody knows this quote, and it's true. It's true. But there are times that we see that even nutrition industry has been violated. Nutrition has been artificial. Food has been artificial, but it's always nature endowed medicine inside food, and we have to write the right ones. So I would like to, as I said, share my perspective. I'm coming from holistic background, and my view and philosophy and my medical philosophy could be completely different than some of you, and but I have no choice to walk you through where I'm coming from and to make sense what kind of treatment I'm offering. Otherwise, if I jump into pathology, which I never do, I'm not going to be holistic. I'm going to be reductionist. So I would like to share all my gathered information with you on this topic. As I said, it might be different in the scientific view as yours, but I'm hoping that could be open up a new horizon or way of thinking, or might be refreshing your mind. My narrative is based on my lifetime investment on holistic approach. And as I said, for the past 3 decades, I'm always in research of finding the truth about health and healing. So I have a lot of stories to share, but it's very hard to talk today because it's a 20 hours of a course. I'm trying to fit it into 1 hour. Definitely, I'm going to miss a lot of points, but I'm trying my best to just focus on something that could be essential at these presentations. We have to know the science of body's dimension as a whole, because as I said, that we are coming from a holistic background, not reductionist. We have to know the science of food and nutrition. What kind of nutrition? What kind of food are we talking about? Is the nutrition, they call it healthy nutrition, is good for everybody? And also the wisdom of natural domain, natural medicine, such as homeopathic medicine, which is a genius and intelligent system of medicine. So at the end of my presentation, I'll leave it absolutely up to you how to perceive it and how to judge it. So as I always said, we are practicing under oath, and our medical oath. And unfortunately, as I always say, I would like to share my frustration that the past 120 years, this oath has been violated with so many different modalities, so many different practitioners. And at this point, I would love to just convey the message that I am practicing under oath, I am educating under oath, and I will never ever violate these principles. So medicine is, food has the medicinal properties in them. So nature never goes wrong. Nature has endowed in medicine inside food intelligently. So I would like to, there are many quotes that I would love to talk about, but my favorite quote is that it's an art. It's living, naturally living is an art, and healing naturally in the world of toxin is an art too. The greatest medicine of all is teaching people how not to use it. So the best physicians The best physician under oath, those are who educating the sick, who educating the patient not to need medications. So we have natural forces within us that they are our true healers. And these natural forces heal ourselves. Physicians, including me, not healers. We are not healers. The healing is an internal domain, and nobody outside of your own body can heal you but your own natural forces. Nothing heals you from outside because it's an internal domain, and your healing power is within you. So if we give every individual the right amount of right nutrition and correct exercise, not too little, not too much, we would have found the fastest way to health. This is another quote from our Hippocrates. So, but there's another thing that I would like to, always I say, right nutrition serves you, and nutrition, food becomes you, because nobody is telling the body how to turn food into your muscles, how to turn food into your tissues, how to turn food to repair your cells. Your body intelligently does it. So if the nutrition is right, then the body knows how to do it. The main thing is that correct and right raw materials to put in your system. But always wrong nutrition goes against you and becomes your enemy. So when we talk about nutrition, we have to distinguish between what kind, for what person, for what DNA, what blood type, what genetic imprint. So when I want to talk about my treatments, or even about nutritional aspect of my presentations, or when I want to treat people, my patients, so the nutrition is a foundation of your health and healing, absolutely. But when we come, the state comes to me, there is often asked, is nutrition enough for just to remove the disease from within? I will talk about it later. But when I come into my approach, I always watch people, my patients, my students, my colleagues, I walk them through philosophy first. If you don't understand how the human body works as a whole, from different dimensions of physical, mental, emotional, and non-physical dimensions, there is no way we can get into pathology. If we jump into pathology, we're going to be the reductionists. We are not. We are holistic. So then I talk about a biological function of the body, physiological function, sometimes anatomical, we have to look into it, and then pathological. There are many, many things that we have to look into it in order to bring treatments to a patient and stimulate and also activate their healing power, and also bring the cure for. So we are not curing, their own body cures itself. So a lot of environmental factors, a lot of lifestyle interventions, nutrition and food, level of activities and level of stress, these are all parameters that we have to look into it. When we say holistic approach, it means that you got to look into everything that can affect all human bodies dimension at physical, mental, emotional, and non-physical. When it comes to my physiological aspects, so as I said, I always look into all these aspects of human body, not just jump into the pathological. So because health and healing is an internal domain and is endowed in every human body by nature without exception, and human body is part of nature, absolute part of nature, and follows the same laws, principles without exception. So we have to understand all these laws and principles. The problem that is happening the past 125 years around the world, because all these laws and principles of healing and cure has been violated by suppressive artificial synthetic medications. They never allow the body to heal itself. They never look into different dimensions of human body in order to, what area it needs activation, what area needs stimulation, what area needs nourishment, what area needs support. They're just giving, putting, patients on suppressive and artificial medication that brought us to this disastrous situation. As I mentioned, human body is an absolute part of nature and follows the same laws. We, as practitioner under oath, if we violate these laws, don't call yourself physicians. You're the enemy of human beings if you're violating these laws not ever changing, because nature never changes its laws. And the same thing with human body. The healing principles within human body never changes the principles, never changes the laws. So in order to restore health, we must administer the most curative techniques and curative system of medicine as a rewinding mechanism tools. The medicine we give to patients, either in a form of food, nutrition, or in a form of another tools, such as homeopathy, these are just activating the healing power within the body. So there is no such a thing that we can cure the person from outside or we can heal the person from outside. So, as I said, the healing is an art, and through our journey of studying, so I truly went through understanding this philosophy, how healing is an art. So, and it's different in every single person, every single individual, and the body artistically and intelligently heals itself with no effort and removes all the underlying causes of disease if we know how to approach it. So as I always say, natural medical modality such as homeopathy or any other natural medicine is a mixture of science and art. But what science are we talking here? So the science with wisdom of the human body or science without wisdom of human body? This is a question. If the science ignoring and underestimating the wisdom of human body to heal itself, that's not called science. I do not call it science. I call science only if it needs wisdom within human body. As I mentioned, the laws of nature is absolute in human body, and nature never follows man-made rules outside of you. Human beings is an absolute part of nature and follows the same laws and principles as programmed by nature. We cannot deprogram ourselves. We cannot deprogram our DNA. There is no such a thing. So the man-made rules based on physical science without wisdom of human body is absolutely the violation of natural laws. And we are here to say we are the follower of natural laws. So as I said earlier, this is a 20 hours of a course that I teach, but sometimes I have to skip some slides so quickly. I apologize for that, because otherwise I cannot get to my main point and my main focus on here. So every holistic modality, such as homeopathy and holistic nutrition, as I said, is the mixture of science and art. So the body is artistically and intelligently knows how to heal itself. You just give it the raw materials from food and nutrition and just treat it well. And or in the case of sickness or advanced form of phase of disease, use a right tool such as wise system of medicine, you're good to go. They're often asking me, do you cure cancer? I say, of course not. I don't cure anything. Your body cures cancer. Your body cures everything. The only thing I give you the right, because doctors are educators. Doctors are not supposed to give medications. Doctors should educate the person, first of all, not to get sick, to prevent from getting sick. Second, not to need medicine in order to just do the way that the education is giving you. And third, if you really want to help them with some sort of tools, give them remedy, not medication. So the holistic, we say we're coming from a holistic approach. This is the law of holism. As I said, the whole human body follows the law of holism. It means all the dimensions of physical, mental, emotional, and non-physical at every single given moment should come into alignment, should come into harmony, should come into balance and homeostasis and equilibrium. These are something that if we know how to do it, just ourselves, we never ever get sick. The sickness always is the misalignment, is imbalance, is the lack of homeostasis and lack of harmony from within. When the body is harmonious, there is no such a thing called sickness or disease. So I think it's a repeat of the same thing. And by holistic approach, we can confidently, and when I say confidently, because I have done thousands, I have treated thousands of patients around the world by my holistic approach. And it's not that I did it, as I said, they healed themselves, but it's just the correct, tools, correct nutrition, correct way of, lifestyle interventions, such as correct exercise and everything. We can confidently and surely remove the disease on time by correct diagnosis, great system of medicine, and through understanding how human body operates as a whole. This is the law of holism. So I always say medications versus medicine. So medication is synthetic, it's a man-made kind of things. We're not talking about that. We are talking about natural remedies. Natural remedies or medicine, it is endowed in food. When we say natural remedies, including the medicinal properties inside food. Human body is producing everything. It's the greatest manufacturers of everything, such as hormones, enzymes, neurotransmitters, painkillers, anti-inflammatory, anti-allergic, natural immune responses, antibody, antidepressant, anti-anxiety, everything you just name it, the body makes it on a regular basis. But everything that it needs to be made needs nutrients, needs raw materials. Otherwise, something breaks down, something goes wrong. So, but unfortunately, when we don't pay attention to this form of deficiencies in nutrients in person or intoxicated, body, trying to make all these natural, materials in synthetically, that's a violation of healing principles. That's a violation of natural laws, and that's a violation of human dimensions. So natural medicine, remedies, or nutrition stimulates, activates, and support the inner natural healing power to produce these essential biochemicals from within and brings forth the cure. Cure is all relying on this. When you have enough hormones, enough enzymes, enough neurotransmitters, enough all these life-saving materials, the cure takes place. It's in no time. So because the body intelligently knows how much of this material you need, when you need it, and where you need it. So unfortunately, we see that how they're treating, people around the world. That is a violation of the law of holism. And as I said, physicians are not healers. Physicians are nature's assistants. So I call myself an assistant to nature. So nature heals, I assist with education, with giving them the right tools and opening up the horizon. So I think I have to quickly go to the next slides. So let's get into the disease. For example, the thyroid conditions, thyroid disease. They call it disease, right? Disease and health, sickness and healing are two sides of one coin or two opposite poles of one phenomenon. According to the fourth universal laws, the law of duality, everything in nature has two opposite poles, everything. And in order to understand one pole, you've got to understand the other pole. If you want to understand the disease, you have to understand health, or vice versa. These are two opposite poles of one phenomenon. If you want to restore health, you can, from the other pole, the extreme other pole, you can rewind it to restore health. That's why we need a rewinding mechanism. This rewinding mechanism could be nutrition and could be another natural remedies. So there is no such a thing that if you're sick, we can suppress it or we can go forward. We have to rewind it and go back to the time that the cells or the tissues or the organs was healthy. So we call it a rewinding mechanism because these two are the same with two different degrees. Disease, it means disease means the body is the body is not at ease, means there is an internal disharmony. Disease means disharmony, means internal disharmony. The opposite, health, means internal harmony. So when you bring in the body from disharmony to harmony, you restore health. The only thing that you have to know how, you as a person, as a physician, what to give the person in order to restore this harmony. The body intelligently knows how to do it. Health is this proper state, the state of proper homeostasis, as I said, alignment, harmony, balance between all dimensions, not only one. There is no such a thing that we have organic disease, such as liver disease, or just the kidney disease or lung disease. When one organ gets sick, means the whole body is sick, means the whole body is not at ease or is disharmonious. We don't have functional disease, we have cellular disease at all the cells of the body. There is no such a thing. If the physical is suffering, the mental doesn't, or mental is suffering, physical doesn't. They're all in one whole unit. We don't have separations between all these dimensions. So when I teach like a mental health, that hey, when we don't have mental disease, we have only one disease, one disharmony that presents in the mind, presents in the kidneys, presents in the liver. There is, the origin is one, it's just one disharmony, but the presentation and manifestation goes to different parts of different dimensions. But you have to understand when it goes to the mind, so what dimension is chronically is being affected. So these are something that you have to understand it fundamentally. So when you bring all the body into homeostasis and alignment, the body regenerates beautifully, regenerates on its own, because it's the nature of the human body to regenerate. After any degenerations, the body regenerates. The same as winter always follows by spring. But the nature never stays on one form of degeneration or one form of dormancy or weakening. It's always and always, follows by regeneration, awakening, and goes on. So the same thing with human body. As I always mentioned earlier, so rewinding mechanism, for me as a nutritionist and homeopath, I use both them as a rewinding mechanism. So I'm going to just pass this to get to the, my focus. So there's always a question. Food and exercise are two huge essential elements of, human dimensions in order to bring human dimensions into alignment. So the health is only take place when all these dimensions are into alignment. Without food, there is no alignment. Without proper activities, no alignment. So, but there is a question, would nutrition and exercise are sufficient to store health at all times? In balanced, normal, harmonious, and aligned body, or in early or benign phases of disease, because every human body has only one disease. We don't have diseases. There is only one disharmony, there is only one disease, but with numerous and countless manifestation of disease. For example, we say hyperthyroidism or hypothyroidism. Neither hyperthyroidism nor hypothyroidism is a disease. They both are presentations and manifestation of one internal disharmony. I will talk about it more in next slides. But when the disease evolves, because disease has benign phases, early phases, and evolves into more malignant and advanced phases if we don't address it on time. So it's happening. So we see it on our immune disease, we see it on our cancer patient. The disease has started already, and it stays actually for a long time at the benign phases. But unfortunately, even those benign phases have been suppressed. Anytime that the benign phases of disease is suppressed, it goes deeper to the body and is going to advance itself to malignant phases. This is true. This is a true science behind all this, malignant diseases. But if the disease moves to more advanced, and the body is severely imbalanced and disharmonious and misaligned, and in advanced chronic diseases, as I mentioned, so we need a rewinding mechanism for sure. We need a mechanism. For me, as a homeopath, my rewinding mechanism is homeopathy, which is, as I said, I have faith on, and I'm practicing it for over 2 decades with I don't say success, because success is so little for it, but I say with faith. Food, nutrition, and natural system of medicine as a rewinding mechanism tool should be compatible in order to heal. There is compatibility with what we do. It's the key that what we do is compatible. For example, if we just we think that we're having a natural nutrition, natural food, but combined with suppressive synthetic drugs, it doesn't work. You already, it's like a loading, unloading your system. And vice versa. If you're using natural medicine with wrong food and nutrition, again, it doesn't work. So we have to understand the compatibility between the modalities that we are trying to give to people in order to heal. As I always say, the flaw science, and the flaw science that does ignore the intelligence of the body, the wisdom of the body. That's the failed methodology. And I said it in my first, beginning of my talk, that I'm not coming from, allopathic model. I'm coming from, holistic model. So the science can be destructive to human body. To me, is not a science. So unfortunately, as I have seen the thyroid, because I have been treating many thyroid conditions, from just benign to cancer, and I never failed. It's not that I never failed, they never failed, but at least with my teaching never failed. So unfortunately, removing human organs instead of removing the disease or internal disharmony by invasive model is unscientific, is flawed and inhuman. So it is definitely an action against the Constitution. I don't want to get into that, but just to share my frustration with you, because when you're removing an organ from the whole unit of human body as a whole, the body goes through a grief for the rest of its life. It's a lifetime grief, causing shock and trauma at all levels of physical, emotional, mental, energy, endocrine system, hormonal system, nervous system, immune system, for lifetime. I have patients coming to me that after they removing their thyroid glands, unfortunately. And so it's a challenge for the body. It's a challenge for me in order to change the body from the original pathways to new pathways. This is a lifetime work. So, because that person has artificial metabolism and is relying on synthetic drugs for the rest of their lives. So complications after thyroid removal, such as unnatural hot flashes, mood swing, anxiety, depression, osteoporosis, water retention, weight gain, and so many other problems, because that body is, first of all, is grieving over, it's like a loss of loved ones. The whole body is like, a loved one is, you know, a family is losing a loved one. There is no such a normalcy coming back unless, again, with the challenging process to bring the body into alignment and harmony. So as I mentioned earlier, there's only one disease, and in holistic approach, in holistic domain, we do not treat a disease, we treat the person, because the person is diseased. The person is disharmonious. That's why you have to understand their mental state. We have to understand their thought process. We have to understand their personalities. We have to understand their nutrition, understand the level of activities, the environments, and everything, because that person has to heal. That person has to be harmonious and come into alignment. So now we say symptoms, and we have seen how symptoms have been unfortunately suppressed the past 120 years, and by suppressing those symptoms, the disease and disharmony go deeper and deeper and deeper, and all of a sudden manifest in a form of malignancy. And now what to do? But when a disease manifests itself differently in different individuals, there is no two individuals, the manifestation would be the same. That's why in a holistic domain, we always try to, it's a custom-made kind of treatment, and to understand the individual, that the individual has to match with the picture of the remedies, match with the picture of the nutrients. Not everybody needs calcium, not everybody needs magnesium, not everybody needs vitamin D. This is no such a thing. Symptoms, as I always say, is our external manifestation of the internal disease. This external manifestation is the language of the body. The body talks to you. When you don't address it on time, it talks louder. Again, you suppress it with suppressive methods. Again, talks louder. For example, we see it in the form of tumors. Tumors is a time that the body says enough is enough. Now I talk to you, you didn't listen. Now I'm coming with the bump with you. And now what to do? You want to go cut it? Okay, I go somewhere else. Do anything to that tumor, I go somewhere else. Because there is no such a thing that the tumor is cancer. The whole person is cancerous now. No matter you cut it actually, you actually accelerating the disharmony to go much deeper. Okay, now let's get into the thyroid that Canfic Pro and Aspires Nutrition asked me to present today. And again, it's my perspective, my view, and thank you so much for just be patient to that I had to walk you through the philosophy of my practice in order to understand exactly what my treatment is all about. So as I said, neither hyperthyroidism nor hypothyroidism is a disease. Even thyroid cancer is not a disease. These are all the manifestation of one internal chaos. It's called disease. As I mentioned, disease has different, phases. I don't want to get into it because it's mostly, for the, academic education at my academy. But I mean, always and always disease evolves from very, very benign, such as excretion, then to inflammation, then the deposition, then impregnation, degeneration, and differentiation. So if you're asking me if nutrition, food, or exercise would help this table, I say it would help this table up to deposition, but after the impregnation and degeneration and differentiation, we need rewinding mechanism as a tool, like homeopathy or any form of natural medicine. So I don't want to get into ancient philosophy and wisdom, because I think all of you know that in nature's 5 elements of earth, water, fire, air, and ether. So the only thing that I would like to talk about at the end, the thyroid is located in the ether or space of the body. There are 2 major organs. One of them is brain, that it's located in the ether or space, and another one is the thyroid, that located at the ether and space. Ether and space is the mother of the other elements in the nature, and human body is an absolute part of nature and has the same 5 elements with the same proportion in the body. So the only thing, thyroid gland is located in ether and space and is the mother of all other glands. The same thing with the brain. And this is very important to understand what thyroid is. So that's why we call it the king of metabolism. The king of metabolism, and also we call the brain the commander of the body. The reason is that these 2 ether or a space that the thyroid glands and brain are located is full of frequencies. Full of frequencies, like a radio frequencies. That's why, some they call it a spiritual center, some call it, a frequency center. So these are the very important to understand where this gland is located and how to treat it. When me as a holistic practitioner, I do not treat thyroid the same as liver, because liver is not located at the ether or a space. We just have to understand exactly based on ancient science where the organs are located. So again, so let me get into the definition of disease from my Trinity of Disease. As some of you might know, so I am the author of Quantum Anti-Aging book, and I elaborated on the disease, how disease starts. We don't have functional disease. The disease starts at the cells, at the cellular level. There is 3 major underlying causes of disease. One of them is a chronic cellular deficiency. Chronic cellular deficiencies, which is related to food and nutrition, chronic cellular intoxications, and chronic inadequate cellular energy flow. So why are these 3 are the major underlying causes? Cells without nutrients dies. Cells without nutrients cannot duplicate. If the cell doesn't duplicate, there is tissue that is not made. Organs cannot regenerate. So we know the cells is the basic unit of our body. So if the cells is toxicated, which we are swimming in the ocean of toxins, externally and internally. Especially the past few decades, our human body is being, kind of bombarded by toxins. And even from our own cellular oxidation, from our own metabolism, assimilation, everything, the cells always need nutrients in order to function, and always needs to remove toxins from the cells. That's it. That's the way that the cells always have to work. And this moves of nutrients in and toxins out is done by electromagnetic at the gate of the cells. So this electromagnetic, because we are electromagnetic device, our heart, our brain, our nervous system, our digestive system, everything works with electricity. we are electromagnetic device. Without that, if there is no adequate energy flow at any cells in the body, that cells is malfunctioning. So if we need that flow of energy at every given moment in order to move toxins, remove toxins out from the cells and move nutrients to the cells. These three underlying causes should be addressed if you really want to remove the disease. Disease doesn't need any medications, any form of suppressive or synthetic medications. You have to understand these causes. When we remove these causes, the disease is going to be removed on its own on timely manner. So disease is the state of internal imbalance and disharmony, as I said, at all levels, and also imbalance ratio in the 5 elements of nature, which I cannot get into it because it's a whole different, subjects to talk about. But when we address these underlying causes, which I have been doing it for more than 2 decades, so disease is going to be removed and harmony, balance, homeostasis going to be back. So according to my trinity of my disease, there are, as I said, 3 fundamental underlying causes for all. Could be acute, could be chronic, semi-acute, semi-chronic, epidemic, and a pandemic. So why in a pandemic or epidemic, some get sick and at the point of malignancy, nothing happens. So these are all goes back to these 3 underlying causes, because the body, human body is designed, is programmed by nature, by the laws, by the principles, and always goes through the cycles of weakening, dormancy, degeneration, always follows by renewal. We don't see that, how the baby is growing, how when we get sick, we come back to life again. This is the cycle, But if the problem here is, if we don't address those underlying causes, the body stays at the cycle of weakening, dormancy, and degeneration. And I have seen it a lot in thyroid conditions, that the body does not go to the cycle of renewal, awakening, and regeneration. So it needs a very high efficient tools in order to kick it and just stimulate it, activate it in order to push it into the renewal, awakening, regenerations cycle. So as I mentioned earlier, the body, it makes everything on its own. The only thing that we should move the body into the renewal cycle. Otherwise, the body doesn't make anything. Just you suffer from long time disharmony. The body doesn't make anything. When we say renewal, is the body when we switch the body from catabolic metabolism into anabolic metabolism. We switch the body from weakening to awakening. We switch the body from dormancy to regeneration, from degeneration to regeneration. This is something that happens all the time in the body. But if the body gets stuck on degeneration period, we have challenge here, and we have seen it in cancers, autoimmune disease, and all chronic conditions, and especially in thyroid. Thyroid is one of the most difficult conditions to treat if you don't know how to treat it. So the body needs 92 essential biochemical elements on a daily basis. They're essential. Essential means the body does not make them. Means they have to come to the body through food and nutrition. And 60 of them, I would like everybody to pay attention to this breakdown. 92 elements, essential elements, 60 of them are minerals. And 12 of them are amino acids. 12 of them are water soluble vitamins. 4 of them fat soluble, I think most of you know. 3 of them are fatty acids, essential fatty acid, and then water and oxygen. These have all of them must be replaced and replenished on a regular basis to assess the body's biological function in order to renew, in order to heal, restore health, and cure at all times. So when you look at this breakdown of numbers, 60 out of 92 are minerals. So I would confidently tell you, people who are going through all this malignancy, they are deficient in minerals. Minerals is the key to your health and is very crucial to be replaced on a timely manner. So as I said, that the human body cannot make these essential nutrients on its own, and must be, come from food. In some cases, from nutritional supplements if required. So we know that the body has reserved funds, reserved nutrients for emergencies, for accidents, for bleeding, for after surgeries, or a lot of emergency situations. If we allow the body to go to this reserved fund, then it's the time that the body breaks down. We must not allow the body goes to the bottom of reserved nutrients. And we have seen it on thyroid situation. A lot of thyroid situation, when I take their case and understand that they're in the bottom. So as we know, as I said, we don't have functional disease. We always have cellular disharmony, cellular disease, because disease hacks the cells. Disease hijacks the DNA. There is no disease if the cells is not hacked and the DNA is not mutated. Disease always happens at the cellular level. So this 2/3 of 92 nutrients that the body needs on regular basis are DNA, are minerals, because our DNA needs minerals. Minerals is like a glue in our DNA. The polysaccharides, the 2 strands of polysaccharides in our DNA, and the 4 steps of amino acid in our DNA are glued together by minerals. And when we talked about the cells, that the cells has a gate. So this toxins has to be removed from the cells and nutrients should get in. And that has done by electromagnetics. That electromagnetics is created by minerals. So the deficiency of minerals is skyrocketing around the world. And that's why the DNA is mutating just on a regular basis. The problem is, but what kind of minerals? Again, that's another crucial thing to understand. What kind of mineral is important? So is it structural minerals? Is it enzymatic minerals? What kind of minerals the person needs? That's why everything is custom made. Everything is individualized. So again, the 3 main underlying causes of disease, as I mentioned earlier, these are very, very important in order to keep the DNA intact and keep our cell, in order. So if we don't address those deficiencies and toxications and energy flow, we cannot remove the disease. And unfortunately, we have seen that they don't fundamentally understand these causes of disease, and anybody can be suppressed by suppressive medications. And this goes further, deeper and deeper and deeper. So now I'm going to get to thyroid, the master gland of metabolism. We all know what who thyroid is from all aspects, so, but not necessarily always people have thyroid conditions and they are diagnosed for thyroid condition. The problem is with thyroid. Many cases that they came to me for thyroid conditions, no problem with thyroid. The problem is in the hypothalamus pituitary gland or in the liver. So I will get there to, that's why medicating things with the symptoms and presentations and manifestation of disease in any battlefield. In thyroid conditions, the disease presents itself on a battleground, which is thyroid. So manifests as hyper or hypo. Hyper and hypoactivities is based on the law of duality. Must happen. It must happen. Otherwise, the body breaks down. That's a calibration. That's the intelligence of the body is doing this. Wisdom of the body is doing it. Because if the body stays at the hyper, would kill, would die forever. If the body stays only at the hypo, would die. But these hyper and hypoactivities is the way that the intelligence of the body is trying to calibrate, is trying to bring the balance, is trying to tell you to listen to me. Do something to bring me into balance. Otherwise, I would do this until something breaks down. And unfortunately, people go to the doctors for hyperthyroidism. They give them anti-anxieties. I have seen patients coming to me with 18 different anti-anxieties. And when they go with the hypothyroidism, they go on antidepressants. That's a level of understanding, unfortunately. So why thyroid is chosen to be the battlefield for internal disease goes back to the phases of the disease. When it goes to the thyroid, it means it's getting to the more advanced phases of disease. So I would love to talk about the communication pathways. On the other hand, we know where thyroid is. Thyroid is on the communication side. We are any time that the thyroid gland is affected, there is a problem with communications. Communication within the body, inside the body, and communication with outside of the body. So communication, thyroid glands communicate with almost all organs and tissues and systems in the body, everything. That's one of the biggest pathways. That's why anything, anywhere in the body that metabolism is form of suffering, there is a problem with the communication of thyroid with that particular part of the body. So thyroid communicates between the physical, emotional, mental, and energy body very intelligently. I cannot go deeper to this because my time is limited. Communication between human to human. I'm talking to you. It's that my thyroid is talking to you as well. This is a communication. And communication between the human body and higher self. So they call it, I'm not, when we talk about a spirituality, I'm not saying the meditations or this kind of, the religion or something. Spirituality, it means alignment. It means bringing all your dimension into alignment. You can do this with your space, ether, and thyroid. So hyperthyroidism and hypothyroidism are two extreme poles of one phenomenon. So there is no such a thing that they are all separated. They're not individual things. As I mentioned earlier, the same thing with health and disease. There are two extreme poles of one phenomenon. So one pole is hyper, one pole is hypo. We have to have a rewinding mechanism to bring them into balance in order to restore health. Again, is the fourth of seventh universal laws that are telling us, and it affects everything in the universe. So we know that the opposites are identical. You see, when you put water to freeze in the freezer, it becomes ice. The texture is different, the degree, the temperature is different, but again, you melt it, becomes water. So these two, we don't have opposite, they're identical, but different in degree. For instance, heat and cold may appear to be opposite at first glance, but in truth, they are simply varying degrees on the same thing. Okay, and we see it in the whole universe, day and night. We see light and darkness, everything, degeneration, sickness, regeneration, health. This is the law of duality. So the law of duality is the base of the law of holism. So if you want to practice as a holistic practitioner, you have to understand these laws and follow them. You know, the same thing with weight, like a weight loss and weight gain. Weight is weight, just two different degrees of weight, but does not mean there are two individual diseases or two individual conditions. So let's get into the hyperthyroidism in terms of manifestation of disease and in terms of how your body is talking to you through this form of communication. So when the communications become fast, so what do you experience? You experience sweating, you experience heat, you experience increased bowel movements, you experience tremor, shaking, agitations, rapid heart rates, weight loss, fatigue, and decreased concentration, and so many things that when you go fast. So that happens. Don't think ever that if the thyroid is working fast, your kidney doesn't, or your some others. Everything, the whole dimensions, all dimensions are on fast track or fast communication. That's why you see manifestation on everything. Why do you sweat? Why do you have diarrhea? Why do the whole system, digestive system, nervous system, skeleton system, everything becomes hyper. But thyroid manifested. Thyroid is manifested in this form. So do we have to do we have to suppress this, or we have to understand the body as a whole is working fast and communicating fast, because something is breaking down, something that there is a major problem. That's why it's rapid. Is that rapid pace? I would like to walk you through what's happening when that becomes fast or that becomes slow. There, as I mentioned earlier, oftentimes that patient comes to me and they say, "Oh, my doctor said you have to go on thyroid medications, or you have to remove half of your thyroid, or you have to completely remove it and just put it in the garbage." So I have when I take the case, I test them and everything. There is no problem whatsoever with the thyroid. There are many thyroid that have been removed illegally, injusticely. They have been removed and had no problem. If you take that thyroid and just go check the anatomical, biological, and there is no problem. The problem is in a hypothalamus sometimes. The problem could be in pituitary gland in the brain. I would walk you through that, what these endocrine organs of the brain communicate with thyroid. There is many communication pathways in the body through endocrine system that we have to understand when we want to treat a person. What pathways is blocked? What pathways need support? What pathways is more deficient? What pathways is more toxicated? We have to understand in order to treat the person. So there is a big communication pathway. I call it the first communication pathway in the body in regards to thyroid. It's from brain, from hypothalamus to pituitary gland, anterior pituitary gland, and thyroid. So thyroid does not make the thyroxine T4 at all if it does not get the thyroid stimulating hormone from pituitary gland. Pituitary gland cannot produce thyroid stimulating hormone if it does not get the thyroid releasing hormone. The thyroid releasing hormone comes from hypothalamus. There are many times I have seen the problem with hypothalamus, and I leave the thyroid alone and I just work on the hypothalamus, And in no time, maybe just 6 weeks or maximum 3 months, everything comes back. And when they go and test it, they cannot detect any problems. Because these pathways is the major pathways from the brain to thyroid. As I said, thyroid does not get sick. The pathways is sick. The pathway has problem. We gotta address this pathway, not the gland. Sorry if I share a little bit of my frustrations. That's how I am, because I've seen so many injustice and around the world. Hyper activities when happens, it's hyperthyroidism. Hyperactivity happens in every single pathways, in hormonal, in endocrine system, in your way of thinking, in walking, in talking, in everything, affects all dimensions. So as I said, T4 cannot be produced or released from thyroid without that pathway to work correctly. So communication between the origin of disease and battlefield. So thyroid is a battlefield. Thyroid is not an origin of the disease. This pathway has to get back to normal. This pathway has to get back to harmony. When I say disease means disharmony, that's what I'm talking about. Disease is not on the thyroid. Oftentimes, disease is in the pathway. So when the communication pathway is corrected by support, by activations, by many things that we have to do, the thyroid is going to get back to normal. So now get into hypothyroidism, another manifestation of the disharmony. The body becomes sluggish. There is the slow communications. Again, we have to go back. The very first thing I have to check is the communication pathways between hypothalamus and pituitary, and between pituitary and thyroid. I will never directly go to the thyroid. There is no such a thing. We don't have this. The problem with reductionist approach is they just dropped off the manifestation side of the disease, and it just brings the body into long-term degeneration, artificial, and at the end is an artificial death to me. So the symptoms of sluggishness and slow communication at all levels, physical, mental, emotional, and energy. We see the person, instead of getting hot, it gets cold. There's a poor circulation, a low pulse, dry skin, hair loss. This is completely opposite of the hyperthyroidism. So you can see the difference into degrees, not the symptoms, only the degrees. They lose weight, they gain weight. They get hot, they get cold. It just explains it itself that these two are identical, but in two different degrees. So again, we have to understand this communication pathway is very, very vital to, I don't know if there is doctors in the house or practitioners. They definitely, all of you understand exactly what I mean. So this is the first communication that I do. And the hypoactivities, as I mentioned earlier, unfortunately, I've seen many patients that come that they have been, put on antidepressant because the body generally is in a hypo mode, and they think that the person is depressed. So unfortunately, that's very unfortunate about this model. And as you can see, these two pictures, they both are the symptoms of one internal disease. So when we're underweight and overweight, I will never ever tell any of them to eat this much or eat that much, because that's not the case. So you have to understand where this harmony is located, and these two manifestations of disease going to be removed on their own. So when the thyroid gland losing their battle, unfortunate, so it's just going to go, out of your way and say, okay, I don't do anything. No hyperactivity, no hyper. That's a dangerous time when the thyroid does not do anything, does not manifest hyper activities or hyper activities. It's a time that you have to understand that disease has moved to malignancy, because none of those states should be suppressed at all. We just have to understand it. So as I said, then it's going to be an internal war, and I call it internal war because disharmony, chaos, imbalance, lack of homeostasis, that's in the beginning, and then becomes huge, full-blown war, internal war, when the thyroid is suppressed by suppressive medications. So I would like to walk you through the other communication pathways that are very, very vital in thyroid situations. One thing I have to explain to you that thyroid is producing T4, is a thyroxine. T4, it means the thyroxine, this hormone has 4 molecules of iodine, but the body cannot use it up, cannot use up T4, has to be converted to T3. It means that T4 thyroxine has to lose 1 molecule of iodine in order to be absorbed, in order to function in other organs and tissues. But who does it? Who does this conversion? Now another case. I have many cases that they come to me for that they are diagnosed by thyroid problems, and they have been on suppressive medication, but the problems is not thyroid, is the liver. The liver is in charge of converting T4 to T3 80%. 80% of T4 is converted to T3 by the liver itself, and the rest is by kidneys and guts, nerves, and some tissues. But the main ones is the liver. So there are times that I just address the liver, just to work on the liver, leave the thyroid alone, and just understand the origin of disease. So the second pathway that is very, very crucial and very important, as I said, is the thyroid and liver. Nothing gonna happen. Nothing is going to happen if the liver is overloaded, if the liver is fatty tissue, if the liver is not functioning well, and your metabolism becomes normal. We don't have such a thing, because T4 has to lose 1 iodine molecule in the liver in order to reach out, to reach to other organs and tissues and cells for metabolism. So the liver is crucial. The second pathways that I look into it is the thyroid liver pathway. So thyroid makes mostly T4, which is inactive form of thyroid hormone, and very small T3, which is not enough for adults, for example, is because this T3 is the active form. As I said, T4 is naturally converted to an active form T3 in a healthy state. So we don't have problems when we are in a healthy state. The liver does functions, the kidney does function, so the conversion goes on, and we have no problem. So 80% of this conversion happens in the liver, and the rest is converted in the kidneys and in the cells of hearts, muscles, guts, and nerves, which is a very small amount. But as I said, always, because the organs and tissues that collaborating together and they understand each other as a based on law of holism, so they cooperate together. They are kind of coming to your rescue. So a little bit of muscles, a little bit of, but when the liver is intact and there is no problem, almost most of the T4 is made by the liver. Conversion of T4 to T3 is done with the special enzymes, which removes one molecule of iodine, as I mentioned earlier. So liver has the highest amount of that enzyme. So the second communication pathways, as I have the illustration here, if you like to just look at it and see how important it is, the communication between hypothalamus, pituitary gland, thyroid, and the liver. So these communication have to be addressed, not the thyroid. So the thyroid and the T4, T3, it's reach out almost to everything. So we see that the body weight has something to do with T3. Brain development, T3. Body temperature, T3. Bone health and muscle contractions, T3. Menstrual cycle, T3. I've seen patients that come for the problem with menstrual cycle, and unfortunately they put them on medication for thyroid and became infertile. So that's, sorry about that. This is just my frustration to share with you. One thing that I would never ever forget is the relationship and the communication between thyroid and immune system. And we see it in Hashimoto's, we see it in Graves' disease, and they call it. So there is a huge problem here. This is a very important pathways that personally I would never leave it out. Even though they're not Hashimoto's, no autoimmune or Graves' disease, but I still work on it because thyroid has affinity and huge receptors of these two subsystems of innate immunity and adaptive immunity. And we know that innate immunity is our border patrol. So there's our soldiers, and they're trying to protect us every single moment. But if there is a problem, they produce inflammatory processes. So that's for our survival as well. And we know the adaptive immunity that produces antibody against antigen. Antigen could be any toxin, could be any particle of wrong food, could be any pathogens, microorganism or something. So, but when it comes to thyroid health, I would never leave it out, because any form of inflammation and any form of excess or wrongly antibodies in the body can affect these communications. And unfortunately, I've seen it that, again, thyroid is a target by suppressive medications, but immune system is doing the job. So there's a big connections, and it's a lot into it. If I want to talk about it, hours and hours of talk about it. That's how thyroid works tightly with immune system.
Dr. Zarrin, we have about 5 more minutes, and then that would leave us 5 minutes to address. We've got about 3 questions. So just to let you know.
Okay, I just want to go into the nutrition now. Sorry about that. So what's something that, because I would like to focus a little bit on nutrition, but when it comes to the health of thyroid in general, no matter is that pathways are affected or, but when the thyroid is malfunctioning in terms of hyperactivity or hypoactivity. So I try to teach my patients to stay away and avoid some kind of harmful chemical components in food, such as cruciferous food, and because my approach is adaptogenic approach, I would ask everybody to stay away from this food for at least 3 months in order to bring the function of thyroid back to normal, because they contain goitrogens, and goitrogens affects the uptake of iodine in the thyroid. So the T4 production by thyroid is going to be affected. And there are many different, food that we have to understand not to take. So because these chemical components have different effects, sometimes at the primary site of the iodine intake and sometimes at the pathways, such as thyroid and liver pathways. So yeah, would definitely, I highly recommend not to have any cruciferous juice vegetables, because again affects the uptake of iodine at the thyroid level, and also especially in Hashimoto's disease and autoimmune disease, I would ask them to stay away from nightshade family. I think all of you know the nightshade families, such as tomatoes, eggplant, potatoes, pepper, and tobacco, and all those things, because they are histamine producing, and it can cause effects on innate immunity, and it's very directly related to thyroid health as well. So yeah, because the nightshade, they have alkaloids, and these alkaloids are they are not toxic, but in like a plants, they are very important that to protect them from mold and pests. But some people, they are allergic, some people have intolerances, and I would ask them to stay away. So I'm very conservative when it comes to thyroid conditions. Okay, and again on autoimmunity, a lot of the different things into it that I can finish it here if you have any questions.
Yes, thank you. My goodness, so informative, and we've gotten so many great comments about how important this information is and how thorough your presentation is. There's a lot of requests for your handout, and we said that one of the benefits of recording is that you can go back and take notes after notes from watching this again and again. First question, I'm going to go in reverse order because you just talked about cruciferous vegetables and what to avoid. What about if you cook them? Does that change the goitin? I can't pronounce that correctly.
Goitrogen?
Yes. Does that change if you cook cruciferous vegetables?
Yeah, when you cook, the sulfur containing compounds or glucosinolates, it's going to get a lot less. But as I said, I am very conservative when it comes to if the problem is just, as I mentioned, the pathways are sick, but sometimes because it's too long and it becomes malignant, the thyroid also we see them, we see it abnormal as well. So at this point, definitely even the cook, but in moderation, personally, I don't think it's going to cause any major issues. But because, as I said, I'm very conservative in my practice, I say just to stay away from them, and no matter it's hypoactivities or hyperactivities, because my approach is adaptogenic. And I say just to stay away from them, even the cooked one, until we get everything back to harmony and normal. You can go back into it.
Fair enough. The next question: can a thyroid disease cause an autoimmune disease and have an effect on the Th1 versus the Th2 dominance?
Thyroid disease can affect the immune system. That's the question.
Can a thyroid disease cause an autoimmune disease and have an effect on the Th1 versus Th2 dominance? That was specifically the question.
Yeah, that's exactly what I mentioned earlier.
Yep.
The autoimmune disease in thyroid is not a thyroid. The problem is with the affinity, the relationship between immune system, the innate immunity and adaptive immunity. It's a problem is that the adaptive immunity is attacking thyroid mistakenly, wrongly. So this pathway has to be fixed. The problem is not the thyroid.
Yeah. We have, I'll try to get through as many as I can in the time we have. Is reverse osmosis water good to drink? Because that's the question. The understanding is reverse osmosis removes the minerals in water. So is that still safe to drink or recommended to drink?
No. because as I mentioned earlier, 60 essential minerals coming from food and water, right?
Mhm.
I'm not talking about metalloid. I'm not talking about heavy, toxic minerals. I'm talking about mercuries or lead, the minerals that we need, essential minerals. But I personally don't go, I go with the benign water. I just have a very basic filter water, and I do not try to remove minerals from water, only the metalloid or toxic mineral, metals.
Great. This comment came in as a comment followed by a question. I think our genetic history the thought is genetic history affecting our system. And this person writes, we have a history of thyroid cancer in our family. Can we actually avoid this genetic pathway?
We never blame genes. I never blame.
Can't blame our parents.
Never blame your parents. Always, we are the one who's blamed. We are violating the natural principles and laws, and the environment that we're putting ourselves in, and the kind of food we eat. Because even the worst genes, if you live right, is not going to present.
Yeah. So we can't use genes as an excuse for what we choose to do with a lifestyle.
No, I have seen patients coming to me and the doctors told them that you have to remove the thyroid because it's the genes is running in your family. Honestly, I can cry for this, and because honestly, it's just I don't know what to say. I try to be just quiet about that, but it's so inhuman. So
yeah. We're going to wrap up with, I think, one more. We have a great comment as well, but the question is, as all diseases in the body heal themselves without medication, can this concept apply to asthma, especially a type of asthma that has a high I can't pronounce today. Is it possible to not have to rely on inhalers? So this is a multi-question about asthma. Do inhalers suppress your body from naturally healing the disease? Woo.
The inhaler is the same form of suppressive medications that suppressing the presenting a manifestation of disease. Asthma is not a disease. Asthma is a manifestation of the disease, and it came to the lung and bronchs and all the respiratory system.
Yes.
The disharmony and the disease is inside and whole body. So, but it depends on it depends on predisposition and tendency, intolerance and sensitivities, environment and everything. Disease presents itself, and the more weakened system or organs in the body, the disease goes there.
Yes.
So, the disease goes there. So, disease doesn't discriminate. But it's always trying to find a better location in order to park itself and manifest and present. But again, goes back to the tendency, not the genes, to the tendency of the individual and predisposition, and the environment, and the way that the nutrition is a huge deal, but asthma, I have taken off many children from these puffers, and these are the worst things that you can. I know some parents are desperate because the children in front of them, they cannot breathe, right? But have the best tools and rewinding mechanism to help the children very quickly, actually, very well. Quickly.
That is a very good place to end this very informative session. Thank you so much. It is about the knowledge that we received today. But one thing, Mary, if I could ask you to do is, again, drop in how we can stay connected or connect with Dr. Zarrin, because there are very much inquiries around how this has caused that. And I think the best bet is for people to reach out to you directly and check out what your services are. I know that you do a lot of work online as well now in this new world, and that's helped a lot of your patients. I want to thank all of you for being here for this session, and thank Dr. Zarrin. Let's give her a lot of love with our captions, our reactions, And please help us at CanFit Pro, provide us your feedback. Please fill out the survey. The link was put into the chat box here. We greatly appreciate hearing from you, as it does help us decide and choose sessions for our future events, and also to fill out your feedback on the session. Please refer to the session number 1003 in your response. Hopefully that'll make it easy for you. Let's take a moment to do that so we can share that feedback with Dr. Zarrin and CanFit Pro. And on behalf of the entire team, I want to thank you all for being here and for joining in on Aspire's Nutrition. We have another day tomorrow, and I hope to see you in a Zoom room there. At this time, I want to say good evening and thank you all. Bye for now.
Thank you so much, Mo. Appreciate it. So
Thank you.
Yeah, thank you. Thanks, everyone. Bye-bye.